Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
All right, what's up, guys? Erin Faules with Zona Health, one of our premium docs. Have the honor of interviewing Mark Young today. He is a CEO of Zona Health. Super awesome guy. We're already chatting a little bit offline. So Mark didn't set out to become the face of cardiovascular innovation, but when he saw the power of Zona Health tech, he couldn't walk away. This started as a short-term consulting role and became a 7-year mission to transform how we think about heart health. He's now acting CEO and leading clinical trials, navigating FDA red tape, and championing a science-backed device that helps people lower blood pressure and reverse age-related decline in about 12 minutes a day. But this is just one part of his story. He's a builder, a growth strategist, and a just start kind of leader. He's got a career spanning multiple businesses and a passion for action over perfection. And he's on a mission for people to take back control of their health, their business, and their lives. He has a recently published book, Radical Generosity, that invites audiences to live boldly, give freely, and create a life that matters. Whether you're scaling companies or sparking movement, Mark's message is clear. Start where you are and lead with purpose. So that's pretty awesome. I think I have a lot of questions from you from listening to prior interviews and kind of knowing a little bit about y'all's device at Zona. But I just want to kind of first, just thank you for being here, taking some time out of your busy day and giving our listeners a little bit more info on how to improve their lives and their health.
Well, I appreciate that intro, Erin. Like that's really every time somebody reads an intro for me, I'm always like, wow, I want to meet that guy. He sounds really interesting. I don't think of myself as being that big of a deal, but when you put it that way, maybe I'm something. I don't know.
Yeah, it's pretty awesome. I mean, I don't think people know, especially this health device that you guys have put out. I mean, I don't think people know a lot of stuff like this exists. You know, I grew up in an area where there weren't a lot of doctors, in a pretty rural part of the country, and I trained in an area where there wasn't a lot of health literacy. And I think the common thought about heart disease and hypertension is just you get it one
It
day because
happens.
you're getting older, and then you get
It's
on a
gonna
med,
happen.
and then you ultimately need to add another med, and then you may need to add another med, and it's just kind of this inevitable trajectory, right?
Yeah,
So to
you just
introduce
keep making them.
something, yeah, like to introduce something that you have control over, that's non-invasive, that is, something that people can do in a small amount of time at their desk, or whatever that looks like, I think is a pretty radical way of thinking for a lot of people.
I'm gonna say this, Erin. So I'm gonna flush out that bio just a little bit and tell you I'm a marketing guy. So my background is incredibly diverse, and my primary gig is I actually own an advertising and marketing agency based down here in Fort Lauderdale. And Zona, that you mentioned, the cardiovascular device, was actually brought to me as an innovation to work on to market the product. And I believed in it. I invested in it, and then later ended up, being invited to spearhead the launch of the product into FDA clinical trials, which is where we are right now. And I've spent most of my morning working on that. But that's the intention is to get that forward. But it really becomes I say it's a storytelling game, right? You're saying that there's people who don't even know that such a thing exists. And the science may be amazing, but if we can't tell the story, no one ever hears about it. And I think in the functional medicine space, I mean, you function in the functional medicine space. My PhD is in functional medicine,
Oh, rad.
and fun, right? So I'm just a weirdo. But the reality is like, I deal with people all the time who I don't practice, but I talk to people because everybody knows if you've got that background, everybody asks you every health related question they have. and trying to explain to people that the body has an innate intelligence and we need to just provide that stimulus. And it's really trying to get that message across, because to me, we can provide all the solutions in the world, but if people's mindset doesn't change, that there are solutions outside of, take another prescription, take another prescription, take another prescription. The reality is that we're never going to deliver a product or a solution that's going to solve a bad mindset. And there's just a re-education to the general public that I think we need to focus on. And I may have taken that in an entirely different direction than where you were going, but that's what was on my brain is we need to deal with the re-education of an entire society. You mentioned the blood pressure medications. My own grandfather died of kidney failure a couple of years ago now. And it's like he was on 5 different blood pressure medications. I mean, literally just chewing up his kidneys with pharmaceuticals to the point that he ended up dying. And I'm sitting here like, if only there were something we could have done. And it's so frustrating when you watch somebody suffer with something that they don't have to, but their mindset is such that they just don't believe there's an alternative there.
Totally. I think a lot of this points to like a larger cultural, societal issue, right? That sometimes you don't know what you don't know. And I think that's a big portion of the population. But then what's interesting is there are people I think that know, but then there's this, I think this might hit on some of the work you do as well. If I'm remembering correctly, you have an advanced degree in psychology as well, right? And I've heard you talk about, not that I've been stalking all your interviews, but I do like to know my guests. So I've heard you chat about how people's minds operate, right? Behavioral, patterns in people, I guess, if you will. And I think there's also a big portion of the population. This is very true in our patient population. We've got a little bit of a bias because by the time people find us, they have some emotional buy-in. Like they are interested in health outcomes. They are pretty health literate typically. Sometimes it's gifted to them and it's an outlier, but typically there's some like bias in the people that we get that they're probably not in that first population that they just don't know. But even when people know, the behavior change is not always there, right? To change the health outcome. And that's such an interesting rabbit hole we could go down as well in terms of like, even if you know what can make you healthier and you know the science, it doesn't necessarily translate into changed behavior and outcomes, right? So that's a whole other, situation, which I really like y'all's product for this because a lot of the barriers people might provide are time or money or taking a pill every day, right? Like some of these things that people have kind of this mental barrier around. This kind of false for a lot of those, right?
Well, yeah. And I mean, you speak to that cognitive dissonance that exists within people. I'm doing something that's not healthy for me, even though I know it's not healthy for me. It's the same as a person who goes shopping and spends money you don't have or shouldn't spend, or it's a negative behavior that somehow we rationalize. And usually I will say it will get down to some kind of dopamine hit.
Yeah, like a short-term reward, right?
Yeah, it's a short-term reward instead of a long-term benefit. And the reality is that we wouldn't have credit card debt up the wazoo if we actually, were able to control our short-term impulses for long-term security. But the reality is I think our health is the same way. It's an investment account. And the sooner we start, the better the interest compounds. And the better decisions we make along the way, the better the outcome's going to be in the years that we actually can't input as much as we used to. And to that point, you mentioned Zona in that context. And let me contextualize because you keep alluding to this device, but let me explain what this is.
Let's just spell it out for people. Yeah.
So Zona is, it's an isometric hand grip exerciser. And that sounds really weird. And people are like, oh, it improves grip strength. And I'm like, well, yes, but no. That's not the purpose behind it. And they're like, oh, it's like no, it's not like that either. Oh, it's like one of those squish balls. No, it's not like that either. So normally I have to let people get rid of all their bad associations before I can actually explain what we're really talking about. But Zona uses the science of isometrics And what isometrics means for anybody who's not familiar with that term, it's the Greek word for equal measurement. And there's a difference between isometrics versus, let me explain. Isometric is pretty much the opposite of concentric and eccentric movement. So picture it this way. My best explanation I've ever been able to come up with is there's the up of a sit-up and there's the down of a sit-up, right? I'm contracting a muscle, which is concentric movement, and then I'm extending that muscle, which is eccentric movement. Isometric is holding a muscle in the exact same tension. So it is not movement at all. In fact, it literally is no movement. So the idea is, think of it as being a sit-up compared to a plank. Okay, a perfect plank is you're not moving at all. You're holding in the exact same position for a period of time, but that doesn't mean you're just laying in the bed. That means you're doing so with a partially constricted muscle group. So it would be a wall sit, it would be a plank, it would be a squat hold. Anything like that would be considered isometric because you have to have some kind of engagement from a muscle group, but no movement. Now, what Zona does is it actually is able to, I'm going to say recreate that movement, but really initiate that movement out of your arm. So you're squeezing it with your hand at a static resistance level for 2 minutes, switching to the other hand, 2 minutes, and then repeating. The idea is that you're creating this isometric tension in the body. It's a stimulus. And that exercise is creating an isometric result, which is systemic throughout the body, not just obviously in the arm where the exercise is taking place. Now, the question, of course, is like, well, what does that really do for you? Like, what does that do? And from FDA restrictions, I would never say it lowers blood pressure. But what I will say is that isometric exercise itself has been linked very significantly to blood pressure reduction. And I would love to walk the audience through the science of that. And then we can get into a couple other things. The science behind isometrics is twofold. There's a short-term benefit and a long-term benefit. The short-term benefit is that and your audience is sophisticated, they'll follow along here, but when the body is in an isometric hold, it actually triggers a sympathetic response by the nervous system because any type of isometric hold is uncomfortable and the body naturally gravitates towards comfort, right? If I'm sitting in an uncomfortable position, I almost subconsciously move to a comfortable position. So when the body's under duress, albeit I'm squeezing this device at a very specific algorithmically calculated compression, I'm holding it at that resistance level, my arm gets uncomfortable. And the body's like, wait, what's wrong? Something's wrong. This isn't normal. Why would we do this voluntarily? There's got to be something wrong. And at a subconscious level, the body actually triggers the sympathetic nervous system. Sympathetic nervous system's first response for anything is that fight or flight response. And it engages the nitric oxide production throughout the body. So as nitric oxide flows through the body, nitric oxide is the most powerful vasodilator that your body creates. Vasodilation takes place, blood vessels open, blood flows more freely, obviously pressure goes down. But that's only a short-term fix because once that nitric oxide is metabolized, you're back to normal. The long-term benefit is actually, and this is what I call the combo shot to the corner pocket, is that age-related hypertension actually takes place because of an endothelial hardening. So the endothelium, for anyone who's not familiar, is like the lining of the entire cardiovascular system. It is like a sponge-like substance that is on the inside of the blood vessel. Picture what happens over time when a sponge dries. When a sponge dries, it's not very flexible anymore. And if it's not flexible, it doesn't move, meaning it doesn't expand, it doesn't contract. Picture trying to wash a glass with a dry sponge, right? You wouldn't even be able to get it inside the glass, much less move around the corners. What happens is that the endothelial hardens. The endothelium is kind of like the thermostat for the blood pressure regulation in the body. And that is that blood pressure can't regulate because the endothelium doesn't know it's high. The endothelium can't expand, so the pressure continues to build up like a kink in a garden hose. Now, when you're doing isometrics, one of the things that happens is you put a muscle group under tension. Here's our combo shot. Muscle group goes under tension. The muscle wants to wants to spasm. Well, in order to stop the spasming in the muscle has to, the cells to support the muscle release sodium, and sodium stops the spasm in the muscle, right? Electrolytes, we're all familiar. Well, sodium and potassium must always stay at a balance in a cell. So I'm putting the muscle under duress in order to push out the sodium, and I'm pushing out the sodium because potassium must also now release from a cell. So as sodium and potassium both release from a cell, when potassium flows into the bloodstream, it softens the endothelium. So the endothelium, which is that dry sponge, imagine over time that potassium is kind of like a water drop on a dry sponge. Little by little, it gets to be more flexible, more flexible, more flexible until the entire thing is saturated and back to normal. When that endothelium is back to normal over a period of time, usually a few weeks, of that potassium being moved through the cellular lining, the blood vessel is able to widen freely. So really, it's almost like just reversing the clock on the endothelium. It's providing zero, literally zero outside substances to the body. It's just letting that body's innate intelligence do what it knows how to do. So our combo shot is I put the muscle under duress, which forces the sodium release. The sodium release forces the potassium release. The potassium release then softens the endothelium, and we're back to normal. That's the way the device functions. That's the conversation. You kept talking about Zona, and like, let me at least explain this so that people know what we're talking about. But the idea there is using the body's innate intelligence to do what it is that the body already knows how to do. One of my pet peeves is that when people have some kind of symptom or they have some kind of, ailment that happens, their first question, what can I take? And my usual response is, proper health isn't about what you can add. It's usually about what can you subtract. Like, what's going in that's causing the problem, not figuring out what you can put in additionally. It's like when you're making a stew, you don't just keep dumping ingredients in, right? You put in only the amount that would take to make it taste the way you want it. You don't just keep dumping stuff in. And I think this solution really feeds into that, because we're not adding anything. There's nothing being added to your system, and yet your system is getting restored. And that's almost counterintuitive, I think, in our Western medicine mindset.
Well, yeah, I mean, even our population is adding, nitric oxide donors and electrolyte support and
Totally.
parasympathetic nervous system regulation and all the different things you're touching on, right? People are
Totally.
aware of these different things in this health space, right? And these are not novel concepts, but the idea of having this all as an inherent, innate capacity of the body that you're just kind of allowing to uncover in a super official way is pretty cool, right? So
Totally. I've got an entire desk full of supplements that I take on a regular basis. I take like 70 something different supplements or
yeah,
pills on a daily basis. And it's like, and to me, that is not because I'm trying to have an additive mindset to that. It's because I want to very strategically supplement what I'm not eating. What is it I'm not getting from my environment
yeah,
anymore? And it could just
yeah.
be because geographically we live in different places, right? Different people get different things. My issue is not sunlight. I live in South Florida.
Totally, totally. You're speaking our language here. I don't know how familiar you are with Wild Health, but we practice precision medicine and we assess genetics and we assess, an individual's strengths and vulnerabilities biologically and genetically, right? And there's a different potential cocktail for everybody. My average patient probably is on 3 or 4 supplements. I'm a bit of a minimalist with supplements typically. But I tend to take away more than to your point about the stew, to more than I add medications and supplements, but it can be done in a very precise way. I mean, historically medicine, in recent history anyway, medicine is done in this quote unquote evidence-based way, which is referring to population-based evidence, right? It's referring to what does the population show in terms of outcomes when X variables introduced. And if you are not the median of that population, it's really irrelevant for you and potentially harmful, right? Like potentially good, potentially harmful, probably irrelevant. So it's super interesting now that we can get these personalized biofeedback devices, which actually kind of segues me back to the Zona. Like you get personalized feedback when you're using this device, right? Because my mind, when you tell me about isometric, work and what that does to our baroreceptors and our endothelium and all these things, like I'm like, well, should we just all be adding planks at the end of our workouts? Should we just all be adding isometric holds in the middle of our strength training? Like, what, should we be working on our grit strength every day? And yeah, probably yes, right? But what is the unique? I kind of know the answer to this, I think, but what's the unique? What's better about using the Zona device? Like, what is it? Is it showing people that they're truly staying in an isometric hold? Like, how much when we're doing something like a plank, are we truly in that isometric hold, right? Versus are we
Yeah.
kind of fiddling around and not truly at that like hold, right?
Yeah, great question. And the answer to all of that is yes. Should we be doing planks and should we be doing isometrics with our workouts? Yes. Because it's the difference between we tend to think of exercise as aerobic exercise, and this is an anaerobic exercise. So it's kind of like the yin to the yang of the workout. It's the people who end up doing weight training 3 days a week, but then do yoga the other three. Like you're balanced, you're bringing harmony, and I think unfortunately, and you're in precision medicine, so you completely preach the same thing. We can talk about supplements, but the idea in this precision medicine world is that you're bringing balance, you're bringing harmony to what's going on. And too often people go way too far in one direction, and that one direction is fine, but we need to find that Goldilocks zone, if you will. And in this particular instance, should we be doing those things? Yes. To the biofeedback that Zona is providing, like what is it doing different than just doing a plank at the end of your workout? And that is, it's allowing you to do it with precision. So the biofeedback that you're receiving while you're using the device is it has you measure at the beginning of each session. You actually squeeze it as hard as you can, which we call the maximum voluntary contraction. So that MVC, I squeeze the device as hard as I can, and then I let go. And then the device calibrates to where it believes based on today's strength, because every day it's going to be a different number, because sometimes you're just more fatigued than others. Or maybe you did it in the morning today, but you did it in the evening the night before, and your strength is just different. When you calculate that maximum voluntary contraction, it then algorithmically sets the protocol for what your ideal Goldilocks zone is for compression today. So you end up holding the device at that static resistance level, and it gives you auditory as well as visual feedback to let you know if you're out of zone. So it keeps you within a 10% compliance range of it calculated where your exact measurement ought to be. And if you veer out of that zone even a little bit, it's beeping, it's flashing, it's telling you to, nope, squeeze a little more, nope, too much, go a little bit less. And it's holding you in that perfect place. So I go to a HIIT gym. So I'm always at the gym doing HIIT training. That's kind of my thing. I prefer group fitness because I think all day long and I don't want to think at night. So I watch people do planks though, and it makes me laugh because, you're doing a plank and I'm watching people do a plank at the gym, and it's like, yes, their arms are on the ground. Yes, their toes are on the ground. No other part of them is, but like the plank turns into a pike, which is, their butt goes way up in the air, and then they're fidgeting to the left, then they're fidgeting to the right, and then they're kind of bent over, then the head's out. And I'm like, guys, like, I get that you mean to be doing a plank, but that's not isometric.
Well, yeah,
So
I'm thinking when you're saying this, how often are people really truly staying in an isometric hold? I mean,
it's not.
by the very definition, it's hard, right? So like
Yeah.
your
Zero movement.
instinct is going to be
Zero.
to move out of it, and with your
Absolutely.
actual nervous system instinct, right? So
Absolutely.
it makes
And,
sense. That biofeedback sounds really rad.
well, what it's doing is it's allowing you to do it perfectly. And, a mentor of mine years ago would always say, practice does not make perfect, only perfect practice makes perfect, and like practice only makes permanent. And when people are doing this imperfect plank, sometimes they think they're getting what they ought to be getting, but in fact, they're not, because it's being poorly executed. And it's no different than the people who want to put an extra 40 pounds on the barbell, but their form is terrible. It's like you're not getting a good bench press out of that. You're getting a terrible bench press and probably a shoulder injury. You'd get a better workout with lower weight and being able to lift it with precision and form. And what this is doing is it's allowing you to do isometrics with that precision and with that form, that you're getting the maximum output. And again, you're talking about doing it 4 times 2 minutes each. So the entire thing, including breaks, is under 12 minutes. So 2 minutes on the right hand.
And is that, not to like poke holes, but is that a bit arbitrary, or do you guys study
No,
like lower and higher
we
amounts
did.
of time? Okay,
We did. So
great.
yeah,
That's
we've got
awesome.
15 years worth of research has landed us in this exact same place.
Cool.
And that is we've done 1 minute, we've done 5 minutes, we've done different percentages of resistance, and this is the Goldilocks zone of isometrics. And it's interesting because I was doing an interview recently, probably 6 months ago now, with a trainer, and we got into this conversation about anaerobic exercise and isometrics, and he said to me, and I did not actually know this, and he goes, "This is really funny." He goes, "Because I love doing planks. I love when I can make all my clients do planks, so on and so forth." And he goes, "And you know what the exact sweet spot is of a plank when you actually, once you cross that line, you start getting diminishing returns?" I'm like, "I can probably guess, but tell me." And he's like, 2 minutes. I'm like, how funny that the perfect plank is a 2-minute plank. And after 2 minutes, you've just put the body under enough stress that it's done. Like you stop getting the impact that you would. So I'm like, well, that doesn't really surprise me, I guess then.
Yeah.
2 minutes. And that's exactly what our research panned out as
Similar
well.
nervous system response to each kind of hold,
That's
right?
exactly right. Because your body
Yeah.
responds, your body gets the benefit of the short-term impact. And then the body realizes that it's not really danger, right? It's almost time for your conscious mind to catch up to your subconscious reaction. And then we give you a minute between hands where you're actually allowed to downregulate that nervous system back to a parasympathetic. You go into that rest and digest mode, and then we freak you out again by moving to your left.
This is a curveball, but we have patients that like to stack these types of habits. And our founder's actually known to stack certain habits for efficiency's sake as well. The people will be using their catalyst while they're doing whatever, or people will be doing kettlebell swings in the sauna. Have you ever used your Zona device in the sauna or something similar that's like already activating that nervous system response? This is just a total curveball, curious moment.
No, the answer is yes.
Okay.
So I actually would always do my Zona while I had my Nano V on my desk.
Okay.
So I would be biostacking.
Mhm.
Nano V and Zona are obvious because the Nano V requires absolutely no focus whatsoever. So it's easy to do your Zona at the same time. Obviously, I've done red light while doing Zona. I've not used my Zona in an encompassed, I'll say in like a sauna. Okay, so let me explain why I'm struggling here. I do use my Zona in the sauna, but it is in my outboard sauna that I use, like from Therasage. So the device itself is actually on the outside because my hands can go through the little zipper holes. So my head
Interesting.
and my hands are out of the sauna. So
But
yes,
your core temp is increased.
correct. But I
But you're
wouldn't
protecting the
use.
device theoretically.
That's exactly right. Like I wouldn't use the
Yeah.
device in a sauna because the temperature would get so high that I don't want to screw up the electronics. Same reason, I don't know
Yeah.
if you're familiar, like I'll take my phone in, but then your phone overheats and then you end up having to put the
Yeah.
phone outside of the sauna too. So
Yeah.
yes,
Yeah.
I have used it while using a sauna, but not a sauna room, but a
Does it
portable.
change? Like, do you get to that point more quickly since your sympathetic nervous system's already activated from the
Um,
heat, or what do you
I
see when
actually
you do
think,
that?
yeah, it's a good question. And I don't honestly know the answer to it because the effective zona is not a short-term thing. It's more of a long-term
Mm,
impact.
yeah.
So I don't know because there is no acute result. You don't finish the zona and feel different.
Hmm.
In fact, what's somewhat insidious about it is that if we're relating it to blood pressure specifically, most people don't even know their blood pressure is elevated. And
Mm-hmm.
that's the crazy part. Like 45% of the population has been diagnosed with elevated blood pressure. And it's like, well, what percentage hasn't even been diagnosed yet?
Yeah,
So
totally. I want to dive in a bit more to hypertension here in a minute because I think this is a whole other like piece of the pie. I think even within the biohacker community and this new age of data capture, I think it's one of the like unfortunately like least measured data points for people,
yes,
especially if they assume they're healthy, right? They're measuring their LP little A and their ApoB and their, HRV and all these things and most people don't have a blood pressure cuff. And so, we'll talk about that in just a second. I did have one more question about data points over time or acutely, which probably is less relevant, as you mentioned. But do you notice a change in HRV over time when you're using this device? Is this something you've looked at personally or in studies?
yeah, the answer is yes. In fact, we were actually used in a study by HeartMath for that exact reason.
Run.
Um, and the reason I would say is not necessarily related to blood pressure.
Sure.
The reason is related to the triggering of sympathetic and parasympathetic
Yeah, the
nervous
autonomic
system
stuff.
response.
Yeah.
So yes, so it's more related to that recovery time that you're able to train your nervous system to downregulate in a short period of time, and that really becomes the HRV conversation is recovery.
Yeah,
So
sure.
Zona's helping you train that nervous system response. So that autonomic response is yes, but not related to blood pressure. Interestingly
Super
enough.
Super interesting. I track HRV a lot. I work a lot with patients with autoimmunity and chronic inflammatory conditions, and there's a huge
That
overlay of a
was
history of,
redundant.
yeah, a history. Well, sometimes they're not yet diagnosed or, immune dysfunction. I feel like it's more, people feel more like it's more accurate for
Auto
people to say chronic
autoimmune is a
inflammatory.
buzzword for me. Autoimmune is a
Yeah.
buzzword for me. I have a sister who's convinced she has every autoimmune disease known
Yeah,
to
sure.
mankind, and every time she says autoimmune, I say undiagnosed, and she'll be, well, I've
Sure.
got this autoimmune. I'm like undiagnosed, and
Sure. Sure.
I'm like
But
we just haven't found the root cause yet. That's the issue.
yeah. Sure, but we track HRV a lot. There's an enormous overlap with when there's immune dysfunction and chronic inflammation, as I'm sure you know, with a history of trauma, nervous system dysregulation, autonomic dysfunction. And so I really like to for a lot of these individuals, especially if they have been kind of in their own driver's seat in their head, hypervigilant, trying to find their own solution, it tends to just feed back into their cycle, right? So when we can find a body-based support system that's going to target the nervous system directly to keep the head out of it altogether, it's so helpful because it takes that hypervigilance and just makes it move, right? Like they can be worried about it. It doesn't matter. It doesn't affect what they're doing, but they don't have to drive. They can just use their body to do something directly to support their nervous system. So I'm always fascinated when I find new, I'll have my patients use acupressure bots or PEMF or,
Yes.
breath work, cold therapy, whatever, name your whatever works for people to target the autonomic nervous system. But this is like a cool other way to do it. That's not also for these individuals. Sometimes other forms of exercise, their systems can be so fragile and that resilience is so poor at that moment that like exercise can be so stressful in terms of oxidative stress and inflammation. You really have to kind of baby step your way back into it. So something where you
Yes.
can, target these systems physiologically without that strain is pretty cool, right? So I love this idea for so many applications.
Yeah, and I love all of that. And you are correct that for the most part, that chronic inflammation is what's leading to so many autoimmune conditions. And part of it is we are terrible, like just straight up terrible about dealing with chronic inflammation by and large because we're symptom focused and we're not root
Hmm.
cause focused. When it comes to HRV, and I'm going to put this out there somewhat in a speculative way, but Zona specifically has actually helps with HRV, but it is because of the downregulation of the nervous system. But what a
Hmm.
lot of things do, and I hate to make this sound a little bit crazy, so check me if I'm going weird. The We do a lot of things to downregulate the nervous system, but we don't train the nervous system on how to downregulate itself. And that's one of the things that I see with Zona, for instance, is I trigger sympathetic, but then I trigger parasympathetic. I trigger sympathetic and then I trigger parasympathetic. But you're moving back and forth and actually
Yeah, like a
helping.
small doses of permitted stress.
Right. It's almost like
Yeah.
microdosing nervous system response where you're going up, down, up, down, up, down, up, down. And that's what heart math was actually studying, was that
Sure.
by triggering that up, down, I put you on PEMF. I'm able to, help the inflammation markers and so on. But a lot of what we're doing is we're just trying to bring that sympathetic nervous system down to parasympathetic. But we're not training it on how to go up and down on its own. We're just artificially bringing it down as much as we can, which again, while I'm a fan of, there's also something to be said about training. It's like interval running as opposed to just jogging.
Totally. I think I mean, I couldn't agree with you more. I think both have their place, especially even
Mhm.
in a time of day, right? Like I'm not gonna probably have my patients do a cold plunge right before they go to sleep, right? But like, gosh, it can be empowering for someone to see getting in a ice bath and their heart rate spikes up and they slow their breath down and then they get down to like the heart rate of 50. Like it's so like that switch in someone to see that nervous system shift exactly like what you're saying is such an empowering thing, and physiologically it's so powerful as well, right? And so our listeners are very familiar with the idea of hormetic stress and these small doses of stress on the system. I think this anti-fragility concept, right, we're kind of getting at, like where you give the body little bits of hard to keep it strong, right? But the dose is the poison, right? In terms of how much hard, and some people are already stacking so many things, whether it's chronic work stress, whether it's alcohol, whether it's whatever. Sometimes that level of resiliency when people first come to us is unknowingly usually very small, and so you really have to like you said, microdose it.
Well, and I want to say this to the biohacking crowd specifically, and that is one of the things that I find is you're right. I mean, people can come in and it's stress and it's alcohol and it's so on. But the problem is I think a lot of biohackers themselves, they're out of hormetic balance anyways, because they're stressing their body with fasting, and they're stressing their body with exercise, and they're stressing their body with supplements, and they're stressing their body with cold plunges. And it
Usually all in the same morning, Mark, and
correct.
add
Totally.
some caffeine in there. Add some caffeine in there. That's
Totally.
our
And it's like,
classic that's our
and
classic
and
biohackers morning.
it's the truth. And the thing is different people have different levels of hormesis where their body will be able to take it because they're trained for it. But there also is this all in kind of mindset that, if one is good, 12 is better.
Yeah.
And we don't keep that balance, right? It's that yin, that yang. It's that Goldilocks zone that we need to be in with our own training. And it's like, I watch people, they'll go into intermittent fasting as an example. And now I feel great. It's like, great. But then they'll rush to the gym because they have a great amount of energy today. But then that crazy hard workout just crushed their body because fasting is great. But then you just added on a whole nother layer of stress to yourself, and your body just can't handle all of it at the same time. Like we need to pick our poisons.
Totally. This is one of the most common things I think we probably see in our patient population. They'll come to us and say, "Oh, I'm pre-diabetic, so I've been fasting more and I've been doing less carb and I've been doing this and that." And we get their data and their fasting glucose is high and their average blood sugar is high, but their insulin's like 1, I'm like, "You're not insulin resistant. You are cortisol heavy." Like you
Yes.
are your body is physiologically very stressed. I think if we reduce your fasting window and add a bit more complex carbs around your training, you're actually going to lower your blood pressure or blood sugar. And we'll have them wear a CGM and they see that exact thing. It's hard for people to buy into that because I think it's so like ingrained in people that the more you fast and the less carbs you eat, the better your blood sugar is. It's not as talked about that stress hormones, you endogenously produce, you produce your own blood sugar in response
Yes.
to stress, right? So yeah, I couldn't agree more. This is something we see a ton. Women more often than men, actually, but even a lot of men, right? But women have so much more of the neuropeptide kisspeptin, and they're so much more sensitive to stress that you see these cortisol derangements and other hormone derangements as well, especially around perimenopause time, like and
I was going to
forward.
say,
Like,
especially around
yeah,
perimenopause, menopause, because now you're talking about hormonal imbalances on top
right.
of all of that.
The capacity for stress resiliency just shifts. So you just need to target these things a little differently. Um, Okay, super cool. People are gonna love this conversation, and I don't think the Zona device is something that like a ton of people haven't brought it to me. So I think this will be a little bit novel to our patients. I hope, in terms of one
Yeah.
more tool in the tool belt, right? When did you guys start putting products out? How long have you guys been around?
Well, so technically the science began back in the 80s, if you can believe
Wow.
that. That's when all the initial research on isometrics had been done. And that's when Dr. Wiley had done all the original studies on it. Our studies have been published in Johns Hopkins University, Mayo Clinic, Harvard Heart Letter, McMaster's University, you name it, like Scientific America, like we've been all over the place. And anytime somebody even studies isometrics, they call us and ask us for discounts so that they can, they can buy the device because it's such a perfectly tuned uh, exercise device. That being said, we've been on the market now for, I want to say it's been about 12 to 15 years. And for a long time, it was actually, the science was discovered during a study with the US Air Force. So it was actually used for probably 5 to 6 years, was sold to pilots.
Mm,
Because pilots can't fly if their blood pressure is elevated, but they also are not allowed to be on, or back then, they
meds.
were not allowed to even be on meds. So this was a way
Yeah,
that they
I was
could
gonna
actually
say.
reduce blood pressure without meds. So pilots would use it all the time, and that was really a sweet spot. And then bringing it to the public has been an interesting thing because again, there's such a pervasive belief system through the population that blood pressure is handled by reducing salt in your diet and taking medication. It's like, okay, but
Mm.
medication is helping you with a symptom. It's not helping you with the problem. And salt is not a problem. And we
Yeah,
have
it's assuming
decided,
insulin resistance, right? When there's a sodium issue like that, right? Like
well,
it's
and truthfully, it's not even,
which isn't even talked about in terms of
you're
hypertension,
right.
like
But
largely.
well, for most people, yeah, for most people, it's the, don't blame salt for what sugar did
Right.
kind of conversation. But even the studies that were originally linked to sodium levels being high in hypertensive patients, it's like they both were there. You didn't pay attention to why the sodium levels were high. You just blamed the sodium levels and called it the cause. And it's like you implied causation and then now have created this entire worldwide pandemic of salt avoidance. And then what ends up happening is people end up salt deficient because
Right.
they end up not taking salt. And the true truth matter is if you avoided sugar, your body will never have too much salt because your body will just urinate out additional sodium. Like
Yeah.
it's not going to be a problem.
Well, and you may not be able to state that your device lowers blood pressure, but I have no FDA issues with this, right? I don't produce the product. And evidence for a long time has been very clear that isometric training lowers blood pressure. Like this is not ambiguous. It's not profit gaining for certain groups that might be incentivized for that. I'll just leave that there. But it isometric grip training has been shown to reduce blood pressure, period, in meta-analyses, right?
Absolutely.
I mean, this is not vague science. And then this
It's
happens to be a way to really precisely isometric grip train,
right.
right?
Well, and
So
that's the goofy part, Aaron. Is like I can tell you that isometrics lowers blood pressure because I can Google that. I can tell you that Zona is a perfect isometric device, but I'm not allowed to connect dots.
sure, sure. Yeah.
So A equals B
We
and B equals C. Draw your own conclusions.
yeah, we've got a pretty bright Haitian population. I don't think that will be a problem.
Totally.
Let's talk a little bit about blood pressure in general and why this matters so much. Because I think a lot of people might be like, well, I don't have hypertension. I'm not on meds. This isn't a problem. And like, first of all, let's keep you that way, right? Like, let's keep your
Yes.
blood pressure low and let's not have this become a problem. But there's such a massive impact on endothelial dysfunction and blood pressure dysregulation within like endpoints of cardiovascular disease, right? Like I think atherosclerosis or like plaques in the arteries, as people might know,
Oop.
has gotten a lot more attention in recent years, which is great. We have things like clearly AI analysis, and we have people are more commonly measuring their lipoproteins, and like it's coming a long way. But even these patients that come to me, they're like, I know my ApoE status. I know I have an elevated lipoprotein A. I know I have da 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 da. I'm like, what's your blood pressure? And like, I don't know. I don't have hypertension, and they've never measured it. And so it's really interesting to me that this is kind of a missed data point in a lot of people. And this is my own personal like data set, right? I don't have a lot of like huge population data to back that up, but I've been seeing patients in this industry for a lot of years now, and this just isn't something super commonly checked and can be really easily missed. And even people that are like, yeah, I think it's fine, and I have them get a cuff, and they're like, yeah, I'm like 120/80 in the morning. Maybe I get up to like 135 in the afternoon, and it's like that's a problem, right? I mean, every 20 points, your top measure, your systolic blood pressure raises in millimeters of mercury, or that top number. By every 20 points, you double your risk of cardiovascular death long term. So that's not a small increase, right? Like in risk. So
Well,
I think this
recent
is just
studies have actually been saying 10 points, by the way. When the
really.
American Heart Association, about 3.5 years ago, I think now, maybe 2.5, they, when you and I grew up, it was a 120/80 was a perfect blood pressure. Then all of a sudden, a few years ago, they're like, no, it's actually 110/72. We're like, okay, so anybody who's 120/80 is now considered, at risk pre-hypertensive, which is super weird. They've also eliminated stage 1 and stage 2 hypertension. That's no longer a thing. And now you're just elevated.
Mhm.
Uh, so it's just weird. I find it very, very bizarre that they just made that change. Again, I'm not here to make accusations, but it's weird that when you change definitions, all of a sudden more people are immediately diagnosed. And when you change the definition, that means more people are getting diagnosed. That means more people need a solution, I suppose. But that's just me being speculative. But the reality is that blood pressure is not a problem until it is.
Mhm.
And when it is, it's a big problem. And it's a big problem that people don't know what to do with. And they reach for the easiest solution because that's the one that every practitioner in town is legally required to give you, or being sued for malpractice, because we've considered antihypertensive medications a standard of care. And now that it's standard of care, if you don't offer it, you can be sued for violating standard of care. So what do I do if I'm a physician? I hand it to you. And at the same time, we're talking about we're talking about a group of people that, and I mean physicians when I say that. You're talking about a group of people who have been taught something, and you can only teach what you know,
Sure.
because doctors are not doing stuff like that to be terrible. But I mean, I was just listening. You know who Jeff Bland is?
I do.
Okay, yeah. Joe Polish just texted me a link to listen to. It's an interview with Jeff Bland, and and I'm listening. It's like you can't blame physicians for doing what they're doing because they've been taught this is what they're supposed to do. And I think the bigger question on this topic of blood pressure is how do we infiltrate that system to actually make the conversation more palatable, where a person wants to talk about these things. But blood pressure, to your point about people not even knowing the numbers, it's not the sexy part of longevity, right? Like, we're worried about increasing telomere length, not controlling our systolic blood pressure, right? Like that just seems like it's the mac and cheese of the health world when I talk about it.
I
Like,
want to poke holes in that a little bit, Mark, because
please.
I feel like we have so many people that are kind of we're past that layer of like that, like sexy anti-aging. Like I have a lot of people that are diving into like early detection, like healthspan blocking
Mhm.
prevention, right? Like this is something I have 30-year-olds interested in now
That's
in their
great.
late 20s, right? Like it is great because things like dementia and heart disease start
Mm.
decades before, the endpoints
Yes.
that are commonly measured in Western medicine, right? I mean, I think
Yeah.
that's very clear. But even for that population, they're not coming to me knowing their blood pressure numbers. They're just it's super interesting to me. It's not,
It
they're
is.
not getting like these insight trackers and function health and these like self-gathering data collectors. They're awesome for what they are, right? Like they don't have someone necessarily, however, guiding them through those results. And this is not
Yeah.
a bash. Like I'm all about people having access to their health data points. But it's not something they can send some blood off and get that number back. Like they have to be an active participant in gathering that data themselves. And I do find that that's a bit of a block.
That's interesting you say that. I'm glad to hear that, actually, because I'm super happy to see that people are paying attention to stuff
Yeah,
younger. Um,
again we're biased, right? We have those people coming to us, so it's a
I
it's a
was gonna,
biased group.
I was going to say, like, I'm curious if that's an audience issue because I don't know that that translates to general population. And some of my bias comes from, and I'll give you an example because I attend all the Dave Asprey conferences and all this kind of stuff, right? And when Zona is present at these things, people are paying attention to the latest PEMF. They're paying attention to the STEM regens. They're paying attention to the, the new sexy red light, whatever's like Zona's there. And we're like, oh, well, we actually help with blood pressure. And they're like, oh, that's cool. Right. Because there's nothing super sexy and novel and whatnot. And I think for two reasons. One is because you go to those conferences and, you know, I don't mean to sound weird saying that, but it's like, it's the most attractive conference you're ever going to go to because like everybody there is already physically fit. Everybody there is there so that they can spend $10,000 on the most novel thing that comes to mind. So when something's a couple $100 and it's not, adding NAD plus to your skincare and it's not, all this kind of stuff, like
Yeah.
it's not the sexiest topic to talk about. Nobody flexes that they got their blood pressure under control, right? Like that's just not that topic that comes up. And I think when people think about it, that seems to, especially in the age group that you're talking about, like that's my parents' problem kind of mindset.
Well, I was gonna say those pain points are probably what bring people into this world, right? They had a
Yes.
parent, they had a friend on a treadmill that had a tragic out, MI, or there's something typically in their family history or in a close connection that opened their eyes to this. You have your outliers and people who are just like, why wouldn't everybody screen for these things to live optimally? Like there are some people that have that long-term thinking, and that's so curious to me as well. But like most people have a personal investment in this and they've seen firsthand what can happen. I think the knowledge and like um I just don't think it's talked about as much, quite frankly, how much hypertension plays a role in these outcomes. Because it's more of like a gateway to these things rather than the endpoint, right? Like it's not, hypertension isn't the thing that immediately, like you have hypertension and you immediately had a heart attack. It's not, it's the thing that leads to and contributes to all of these other endpoints, right?
100%. Well, and I want to, if you're okay with it, I would love to pivot for just a quick second on something you said. And I don't want to
Yeah.
dominate your conversation.
No, please.
Um, but you've used the word several times, and I want to touch on it. And that is, you've used the word thinking.
Mm.
And when people come in and they think that this is this, or they think that is that, or they are, I had a family member and thus I'm paying extra attention to this. And particularly as it relates to the nervous system, but throughout all aspects of the body, the reality is that we are, we're thinking beings who are creating our own realities. And in so much of this, I will tell you, like, why is it that blood pressure can be extremely controlled through breathing exercises? Part of that is nitric oxide release. Part of that is, multiple different physiological things. But part of it is literally the psychological impact of how our words and how our belief systems affect our health. And I think that there's a huge component to all of this for a person who comes in and is already walking in the door with a diagnosis in hand. That, you talk about like continuous glucose monitors for diabetics or people who are, dealing with insulin resistance. And it's like, there's something to be said for a person who keeps telling themselves they're diabetic. And I think that there's, again, I'm looking at that balance of the conversation that is like, yes, hypertension is a thing. And yes, we need to be able to, to deal with that. And we need ways that are non, medicinal in their treatment. But at the same time, we also need to get out of this mindset of this is just who I am. And I think too much of the population walks in and, oh, I have hypertension. I am hypertensive, blah, blah, blah. And
Or
so
let's take it one step further. I am a diabetic. Like it actually becomes
correct.
identity, right?
It's an identity. Correct.
Yeah.
And that's exactly my point. Like you walk in the door and you're like, I need a solution for this because I am. And I'm like, quit speaking that into existence, because even if you weren't, you would be in a minute. Like even if you weren't diabetic, if you keep saying it, you're going to be, because you're telling your body that it needs to behave and defend against something that's not even a foe. Like this may not, and maybe it is, but the reality is like it's this identity mindset that I think we cause way too many issues for ourselves. If we can just get out of that, it would be amazing. Because I do think that when we deal with people on a regular, it's like there is so much symptom removal mindset, because we've identified with the core. Like we've made 100%, like the I am diabetic statement. Like we've already identified, we've already made part of our identity this diagnosis. All I'm trying to do at this point is eliminate the discomfort of a symptom. I'm not trying to ferret out a root cause. I'm not trying to solve the solution for that. That's just who I am.
Yeah.
You know?
Yeah, no, I think that's really important. I work with this a lot with my patients that have either diagnoses of or a concern for autoimmunity. There's a lot of like identification with brokenness, and it is becomes this hypervigilance in an effort to protect yourself and to protect your body. But it becomes kind of its own endpoint, right?
Yes.
So it's super powerful. I think, a lot of our patients are super into Joe Dispenza and this whole like our
He's not
beliefs,
wrong.
affect our outcomes. One of the first people I ever read anything on the subject of epigenetics was The Biology of Belief in my training by Bruce
There you
Lipton, and
go.
I'm like, whoa, like this is so interesting. So I couldn't agree more. I thought of one more question that I think is going to come up for, if you can't speak to large data sets with your device, don't, just speak to your own personal experience, right? Like we want you to, yeah, you'll be in charge of your own boundaries there, I suppose. But, if people have normal or low blood pressure, are you seeing problematic dips when people use this? I assume not much, like when people take nitric oxide donors, we don't see that, right?
Well,
But
so
I
the
mean, maybe
issue
if
with
they're taking like sublingual nitrate, they will. But I mean, I'm talking about like some of the like L-arginines and things.
yeah,
But
correct. So yeah, if you're taking L-citrulline, L-arginine, beet powder, whatever, like you're not going to get too low. And the reason for that, to piggyback onto some of that, is the reason we don't see, and I have no anecdotal or clinical support to say that somebody's blood pressure would go too low, but I want to point out a mindset problem, and that is no solution for blood pressure that is a natural solution drags your blood pressure going too low. The issue is we've gotten so accustomed to the use of medications that medications are dropping your blood pressure too low if you're over medicated, because they're not dealing with the problem, they're dealing with the symptom. When you're using, for instance, Zona, you're resetting the endothelium. You
you're
can't
just
tape.
restoring homeostasis,
You're
right?
just restoring it back to normal. Like
Yeah.
all we're doing is reversing time on the endothelium function. That there was never a point in time that you were born too low. Like it was normal. You're just taking it
The-
back normal.
Yeah, this I think will be a common thought in people listening, because there's such a big population of people with chronic cortisol dysregulation, autonomic dysfunction, especially post-COVID, and like these other situations where people are running pretty low in their blood pressures and actually can have some circulatory issues on the other direction.
Yes.
When there's, chronic adrenal strain, sometimes you're seeing more sodium wasting, and like I think this will become a question. So it's good to know. Much like in
Yeah.
exercise, you don't see,
No, it's fair.
exercise dip too low unless you're truly, I guess, getting too hypervolemic and like losing too much fluid, maybe, I suppose. A little
Totally,
bit,
but
but
that's what I tell people. Like they're like, "Well, can I use it too much? Is it okay?"
yeah,
It's like a treadmill, folks. It's exercise. Like it's
yeah,
very specific, targeted exercise.
yeah.
And and telling people, the next big question that comes up is like, "Well, does my blood pressure go right back up if I don't use it?" And the answer is no. It's no different than you don't gain 40 pounds the day you don't step on a treadmill, right? Like
And
if you
yeah, and if people don't have the like it meets you where you are, right? Help me explain the
Yes.
elementary of this a little bit. Like if people don't have, like I formally have a lupus diagnosis. My grip strength isn't insanely good, but it would it's moot, right? Because I still can maintain my own isometric hold, right? Versus even an elderly patient that might have arthritis or what have you. Like it
Correct.
can still meet them where they are and
Well,
find that
correct. And that's
balance.
the
Okay.
reason I had mentioned that maximum voluntary contraction before, right? That it's going to calibrate to your grip strength. So
Yeah,
your
got
grip
it.
strength and mine are different, but it's
Yeah.
going to hold you to a percentage of yours. It's going to hold me to a percentage of mine.
And are you seeing people's grip strengths improve over time? Because that's a separate
They
marker
do.
that also does correlate with longevity pretty strongly, right?
I've got a theory on that, but the
Yeah,
answer is
please.
yes. We do actually notice that grip strength does improve over time because you're literally working your grip strength, although the purpose of the device is not grip strength enhancement. My theory actually on grip strength being correlated to longevity, because nobody has actually been able to demonstrate why that is.
Is the
Um,
isometric hold?
Pardon?
Is it the isometric hold?
I actually believe it's because of the isometric hold.
Yeah, yeah, that makes
That
sense.
that the reason that grip strength and longevity are correlated, but no one can figure out what the connection is actually because people who have a stronger grip strength actually have better isometric. They've been doing isometrics one way or another, and because of that, they've actually increased their cardiovascular health. So it's a
Yeah,
weird connection. There was
rad.
actually a study, the best study on it, and I can't remember who did
That
it.
makes too much sense, Mark.
I know, I
Don't
know.
throw common sense into it.
Here's me with low hanging fruit in today's conversation. But there was actually a study that was done, and it was done on fishermen that were actually in a like fishing village off the East Coast. And there was not a single person in the entire place that had high blood pressure. And they couldn't figure out how nobody had high blood pressure. And they ended up figuring it out over time. So they studied it to find out what was going on. It was because they would carry the fish in boxes, and they would carry the fish with their palms up and their arms out extended and the box in their arms. The reality is carrying a box like that, off a boat all the way to a truck or whatever they were doing with it into the processing area, they were doing isometric holds all day long, just in the way they were carrying the box. That, it just turned into inadvertent isometrics. Always found that fascinating. There was a study, and I don't remember actually who actually did the study, to be honest with you, but it was in a fishing village on the East Coast. And the nuance of the entire thing was that nobody had high blood pressure in the entire community. And it was just this weird anomaly, and it was not a blue zone issue or anything like that. But what they actually had finally made the connection, because they're like, what is going on here? The connection was that when they would carry boxes, they would put the fish in these crates and would carry the crates palms up, arms extended. And that's how they were being carried. So wherever it was, from the fishing boat to the warehouse or the truck or wherever it was they were taking them, they were literally doing isometric holds all day long. Like, because of the way they were carrying the boxes, it's an isometric hold. And it's kind of funny because they inadvertently were lowering their blood pressure through this isometric. So that same theory, or that same practice, is my connection between why I think longevity and grip strength is highly correlated. That no one's connected the dots yet. So you heard it here first.
Yeah, it makes so much sense. I love that call out, and I'm gonna look up that study. That's super fascinating. I think it's always so cool when you find these populations of people who do something in a way that makes sense for them. It's probably not as in an effort to lower blood pressure. It's probably
Totally.
not why they were carrying their fish in boxes that way, right? But I think we can learn so much from it. So, and it's so interesting. I think the common thing I hear with stories such as that, it's like just going back to the way we're made to move and live, right? Like people spending, I mean, bringing it back to blue zones, quite frankly, in a way, but people, carrying their own thing and working outside and connecting with loved ones and living by the rhythms of the sun. I mean, these things are are
Absolutely.
vitally important.
Eating the food that you grow in your own area is like one of the most fascinating things. That this is going to sound like so dumb and you're going to laugh, but like honey,
Mm.
honey to me is one of the most fascinating things that's ever been created, because it's so funny to me that you should only eat honey that's grown in the area where you live, because the pollens that end up in the flowers that end up creating, that the bees take and make the honey and all this other kind of stuff, like you trigger allergies and histamine responses when you're eating honey that's made in an area that's not indigenous to where you live. And it's like, it makes so much sense.
Yeah.
But it's like, and people in blue zones aren't importing honey from 1,000 miles away, right? Like they're eating the food they grew.
Yeah,
Yeah.
there's so often an evolutionary route that makes
All of
so
it.
much sense, right?
Oh,
And,
Erin.
and I think if we just simplify our lives, like we have so much less
True.
problems.
Well, I've said this a lot in conversations lately, and that is, somebody asked me, what am I learning most? And I'm like, actually, I think I'm unlearning more things than I'm actually learning. And part of that is, debunking a lot of the things that we've just been brought up to believe are normal. And part of that is leaning back into so much science today is just proving ancient wisdom. Like we're just proving it over and over again. We're proving ancient wisdom was accurate. And, this idea, like, even I won't get into all the craziness, but I'm a weirdo about, frequencies and vibration patterns and stuff like this. And it's like, years ago, I would have thought that was just really woo, right? Like that's just a little too woo woo for my world. And then but I'm like, but it's measurable. Like we can actually measure it now, and we see that. And I'm looking at things like, animals, like, kosher and halal laws and stuff like this, and the idea of killing an animal in a non-traumatic way. Well, now we understand that the trauma that is at a cellular level in the animal, when the animal is killed in a traumatic fashion, is stored in the meat. It's like, so we're eating traumatized meat because of the way that it was killed. I'm like, okay, well, I don't suppose ancients understood cellular trauma the way that we do today, but they abided by it and they were healthier. like this is ancient wisdom being proven accurate over and over again.
Yeah, it's super interesting. And there's all these like personalized like biofeedback devices that you can use now that kind of measure your own energy. I have had a lot of patients who have had pretty phenomenal results with a variety of symptoms. We
Oh,
have a prior physician that worked at Zona Health that runs a company called Immortal that they work on
I
in
know the
this
device
energy
well.
space. Yeah, it's something I don't know a ton about personally, but gosh, I'm not gonna knock things that people tell me this works. And I mean, since the beginning of time, physics tells us we all are energy, right? Like this is not novel. This is abstract for a lot of people to think about, myself included. We're used to seeing numbers on a piece of paper and used to seeing people in the form of a human being, not energy, right? But so it's easier for me to think about it that way, and it's not something I'm an expert in by any stretch, but it's something that comes up here and there with my patients, and I've heard enough positive stories that I'm definitely not gonna pass some judgment, right?
If you're ever interested, I can introduce you to some of the leaders in that crazy space. But and again, it's so weird in so many ways. And yet the reality is you can't not do it. Like friends of mine, Lisa Piper and Wendy Cohn, they run a company called Code Health. And Code is actually, they imprint frequency into saline. Really, it's just saline water. But the imprinted frequency in the water actually mirrors multiple different types of things. Like they've got like an like a allergy, like an antihistamine frequency in saline, and you put a drop under your tongue and your sinuses are good.
Interesting.
They've got pain relief, they've got hunger suppression, they've got you name it. They've just taken the frequency of other things and been able to apply that frequency. There's a company called Intelligent Threads. Super cool company. I just had the CEO on my podcast, And it's like, and he's got, his name is Brian Brzezinski, super cool guy, but it's frequency imprinted clothing.
Yeah, I'm looking.
And like, it's the weirdest thing because you don't even have to necessarily be wearing the clothing. But like, for instance, I had a shoulder was super tense and he's like, you feel that tension? I'm like, yeah. He took a t-shirt and just threw it over my shoulder, like draped it over my shoulder and then did the exact same movement. I'm like, holy smokes. Like it literally like released the tension in my shoulder. And I'm like, that's nuts. But it is fascinating. And I think the lesson in it is not that everybody should run out and study frequency. That the lesson is to understand that there's a lot we don't understand.
Yeah, that's for sure. That is for sure. And I like to say when people challenge new ways of looking at things and health, I'm like, well, the current way is not exactly working the way we would desire. So let's expand our
Correct.
mindset, right?
Everybody's
Uh,
crazy and everybody's crazy until they're not.
Yeah, for sure, for sure. Super cool. Well, Mark, this has been such a educational episode for me personally. I think people are going to learn a lot about this. I love getting work on hypertension more out there to our patient population and just in general. I mean, this is pervasive in, today's society in terms of like how common this problem is and it's super serious in terms of what it leads to, but I think there's benefit in preventative measures as well. So this really does apply to everybody. And I just enjoyed getting to know you and learning a little
Likewise.
bit about what you do. I selfishly love interviewing people who are in the medical field, but weren't just trained in the medical field because I think it brings such an interesting mindset. I love being the first doctor in my family because I feel like I, from the get-go, questioned. I wasn't in the dogma, right? Like I wasn't raised that this is the way you do it. I was raised curious and kind of a beginner's mindset to medicine. And I've always valued that was my upbringing. And I love interviewing people that have a little bit of a different perspective than just talking with other docs. So I really appreciate you coming on.
I love that. And just so you know, Erin, while we've been talking, I went ahead and created a coupon code for any of your listeners who are interested in
Awesome.
getting. So anything at zona.com, zona.com. Use coupon code Wild Health, one word, and it's a 20% off anything site-wide.
I love it. I will put this out there for our listeners when I put it on our social as well. I'm sure people will be super
Awesome.
fascinated and we will let our patients know when we work
Love it.
with them. So couldn't be more grateful. And then if you want to share your book, I know we didn't dive into it. We certainly can if you
No,
want to a little bit. But if you want to just share, if people want to learn more about how to get in touch with you, your product, you did just
absolutely.
mention the Zona website, but go for
Yeah,
it.
the Zona website is just zona.com. And if anybody's interested in getting a hold of me, following me on socials, learning more about my books or anything, just go to themarkyoung.com, just themarkyoung.com, easily to spell. And everything's there. You can stalk me that way.
I love it. I love it. Well, super excited to get this message out. Thanks again, Mark.
Appreciate you. Talk to you soon, Erin.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.